and showing your proof of vaccination at venues and events. A big thank you to those venues that were quick to adapt and provide a mechanism to create safe opportunities, venues and events. Over the most recent outbreak, it's so encouraging to see so many people willing to do the right thing by their fellow Western Australians to help keep each other safe. The way all West Australians have conducted themselves over the Christmas and New Year's period has been fantastic. It's the reason why we've been able to confidently ease public health measures, and we have successfully tackled our Delta and Omicron outbreaks so quickly. On the Omicron leak from the Hyatt Quarantine Hotel, in total, the 2 cases had 33 contacts. So far, all of them have tested negative, which is very, very pleasing. I can advise overnight, WA has recorded 3 new local cases of COVID-19. All 3 were in quarantine already and are not believed to have been infectious in the community. One is linked to the Delta backpacker cluster. The other 2 are household contacts of returned interstate travellers. This is obviously good news from 2,573 tests conducted yesterday. Right now, Western Australia is managing 89 active cases of COVID-19. Over half of those are in home quarantine. There are still a sizable number of entries into WA despite all other jurisdictions other than the Northern Territory being classified as extreme risk. 380 people will arrive today on 5 separate flights. This includes 138 from the Northern Territory who will go into self-quarantine. Yesterday, 227 truck drivers were stopped at the South Australian border and were required to take a rapid antigen test. Pleasingly, just 1 was positive. That truck driver has now remained in South Australia. These numbers illustrate 2 things. 1, despite challenges over East, there are still sizable freight movements coming into WA to ensure continuity of supply. With this sheer number of cases in the rest of the country right now, it is placing pressure on supply chains across a number of industries. There is a dedicated team working hard to ensure our supply chains continue to operate safely. The second thing it illustrates is the risk of another outbreak prior to our safe transition plan. Keeping in mind the daily case numbers around Australia and now more than 100,000 at present, does not include those people who haven't been tested. It means there are genuine risks at play, from freight movement, limited exemptions and the like. It's a reminder of the importance of vigilance for all Western Australians, of using Safe WA, staying home when sick, getting tested and of course getting vaccinated. With regards to vaccination, WA now has a first dose rate of 93.9% for those aged 12 and over. Our second dose rate of 86.3% of 12 and over. This is incredibly encouraging and shows the overwhelming compliance and acceptance of the need to be vaccinated in our community. Our third dose rate sits at 14.5% for 16 years old and over. This is a good number considering those eligible. However, we need to get this up as quickly as possible. So please, if you're eligible, book your appointment and get that third dose. It gives you the best protection against Omicron. Don't wait until it's too late. Today is the first day children aged 5 to 11 are eligible to be vaccinated. 13,399 bookings have been made between tomorrow and the 24th of January. There are still over 5,000 appointments available for parents to book at state-run clinics. We are also sharing some of our paediatric vaccine supply with GPs who didn't receive the supply they were promised by the Commonwealth, which is disappointing this far into the pandemic after assurances were made. We received 33,700 doses on Friday and expect to receive that each week, but we will provide some of the doses where we can to GPs and pharmacies which have not yet received the doses they are expecting from the Commonwealth. We know that many parents will want to take their children to GPs like they do for other childhood immunisations, but I want to assure all parents that our state clinics in Perth and across regional WA are there and available to be used. With regard to proof of vaccination requirements for higher risk venues and events, as I mentioned earlier, the interim policy brought in to help us transition out of the backpacker outbreak safely has been a success. Again, thank you to those businesses for complying and adapting so quickly. For clarity, all events with 500 or more attendees and with a managed or controlled entry will be required to comply with the proof of vaccination requirements. We want to make it as easy and consistent as possible. On that point, I also want Western Australians to understand that the current proof of vaccination requirements will be expanded further in coming days. We are currently finalising a longer-term policy which will cover a wide range of licensed events and venues, restaurants, as well as riskier environments like indoor fitness centres. This policy will come into force as we move closer to easing border controls. We know that unvaccinated people are well and truly enormously overrepresented when it comes to cases, serious illness, hospitalisation, intensive care presentations and death. Far too many resources are being used over East to care for individuals who would not take the basic steps to care for themselves. If you, for some reason, have not had your first dose yet, my advice would be to make a booking today. Otherwise, life is about to get very difficult for you. Tomorrow, we will launch a new app to make the whole process of showing your proof of vaccination easier, which will be important as it will become far more frequent in the lead up to the safe transition. Thank you very much. Any questions for me?
Clarification with regard to the point of entry vaccination requirements that you just mentioned, all events with 500 or more attendees with a controlled entry. Does that or does that not include AFLW and sports events at stadiums before Feb 5?
My intention is that it would include those sorts of events as we move forward. So the advice I have is we don't have any major sporting events prior to February 5 scheduled, but there's events that are out there. So we'll move towards a proof of vaccination requirement for those major events going forward.
Was the weekend at Freo Oval a mix-up? Because it did seem to fit the criteria online from the Chief Health Officer, but they were then advised they didn't need to check.
Look, what we put in place was an interim policy, and that was put in place as a response to the backpacker outbreak, as we call it. I'm not going to second guess the Chief Health Officer's advice, but as we move forward, we're going to ensure that those large events, and indeed licensed premises, indoor fitness centres, gyms, even cafes, you'll need to be vaccinated to go into those sorts of places. So that will be the policy as we move forward. We'll announce further details of that in coming days. But my advice to people is get vaccinated, or else you won't be able to do those things. You won't be able to work in certain premises. You won't be able to work in certain venues. Getting vaccinated is very important.
But his advice did seem to include Fremantle. It said all licensed venues capacity over 500, but then it was when they checked, they were told it didn't. Is it creating confusion that the goalposts seem to move at short notice and seem to move in favour of certain industries more than others?
Look, as I said, I'm not going to question the Chief Health Officer's advice. Moving forward, we're going to put in place more opportunities and more venues where people will be required to be vaccinated.
And that will come into effect prior to February 5?
Yes.
With regard to childhood vaccinations today, a lot of parents are having trouble getting bookings any earlier than late February, early March. The Armidale booking system, I'm told, is down today, so people can't book or walk in Armidale. Are these problems making it difficult to get enough of the school population vaccinated before January 31?
I'm unaware of that, but I just urge people to be persistent. I'm advised there's 5,000 appointments available over the course of the next 2 weeks. Obviously, there's certain limited numbers, and obviously we're trying to get the third doses done, and those people who have first and second doses still required to be done. We're trying to put them through the system as well. So we're doing the best we can in the circumstances we face.
Is there a target that needs to be met for schools to safely open January 31 or when the borders open?
No.
Can you explain just why some GPs were caught short of the vaccinations for children?
Well, I'm advised it's a supply issue from the Commonwealth. So some of the GPs, perhaps pharmacies, haven't received the vaccines that they were promised. Therefore, they haven't been able to deliver supply, particularly for children. So what we'll do is we'll provide some of our doses that we received. We received 33,000 or thereabouts. So we'll provide some of those to GPs and perhaps pharmacies in order to try and give them that supply they need.
Rapid antigen tests available from today in WA, are they? How's that going to be rolled out? How are they going to be used here?
We've made them lawful and therefore available. I just advise people not to use them unless required. At this point in time, we're not aware of any COVID in the community in Western Australia, so there's no need to use them at this point in time. So we have PCR testing available at clinics. You can go and get yourself tested. It's a more accurate test, as we know. And so I just urge people to use that opportunity that's available in Western Australia at the moment. We need to husband our resources when it comes to rat tests, so we've ordered huge numbers, but we need to make sure that we have them available for when we need them.
Are you concerned about
Sorry, did you have another question, Rihanna?
Have you received the state's share from the Commonwealth from France?
No, we haven't. The Commonwealth has made available 10 million rat tests to the states and territories, but they're not providing any to Western Australia. So we're the one state that is not getting any. So I've written to the Prime Minister to ask for our share of rat tests. Seems to me it's not fair that Western Australia doesn't get any from the Commonwealth. I expect the reason they'll say is other states have huge outbreaks of COVID, but we never know what's around the corner. We don't know if we'll have an outbreak at some point in time, and we need to have our fair share. So we've asked the Commonwealth, and I've written to the Prime Minister to ask for our share of that 10 million. So our fair share would be 1,100,000 of that 10 million. That would be the population entitlement of Western Australia. And we certainly shouldn't be punished for not having COVID here. So I just say to the Commonwealth, please give us our fair share. We went through this with vaccines, you might recall. Western Australia's share or some of our share of vaccines went to New South Wales, and all that happened then was, because we didn't have the vaccination rate at that point in time of New South Wales, we were attacked, even though we gave our share to New South Wales. So I'm asking the Commonwealth, please provide us with our share of those rat tests like every other state and territory is receiving.
Do you know what the protocols will be yet regarding those rat tests for people in a workplace that may have access to them and to determine whether they have COVID and return to work?
Well, we're working that through. So what we're doing is watching what happens in every other state at the moment and how they work it through. And as you see, the rules are changing regularly at a national level based upon circumstances. So we'll work through our exact rules in the lead up to our safe transition.
Are those rules likely to change ahead of February 5?
I'm sorry, Josh.
Previously you said that WA's testing and isolation requirements weren't likely to change prior to February 5. Have you reconsidered that in light of what's going on in the eastern states?
Well, you make tweaks at various points in time to different things. So, for instance, we've gone to 12 days in hotel quarantine plus 2 days in a home quarantine environment, so those sorts of things are tweaked. But the reality is Western Australia is the only state or territory now with a testing, tracing, isolation and quarantine system that's actually working. So ours will continue to work for as long as we can make it work. And the experience in other states is at some point in time it gets overwhelmed, but we'll continue to use it in as an effective way that we can in the lead up to that point in time.
The experience in other states is that you have widespread worker shortages, at least for a period of time. Is there any thought being put towards trying to avoid that?
Yes, there is. Yes, there is, and that's why we're watching what other states do, particularly in relation to the furloughing requirements, or otherwise known as the isolation requirements for people who are close contacts. Sorry, the close contact rules. So we're watching the close contact rules in other states in the lead up to February 5. We'll calibrate exactly what the rules will be here in WA.
Given that and what is unfolding over East and your previous comments that February 5 is locked in barring a catastrophe, how do you rate the chances of WA reopening February 5? Is it still locked in your mind?
So February 5 is the date. I just urge people to get vaccinated as soon as they can, their first, second or third dose, in the lead up to that point in time. I'd urge parents with 5 to 11-year-olds who aren't vaccinated to go and get them vaccinated just make sure you do everything you can to protect yourself and your family.
Is there still any chance of a delay? Because there seems to be two cohorts in the public at the moment, some very for the border staying, some very for the border opening, but there is rising public anxiety in the middle, I think, approaching that date.
All I'd say, look, I'm not going to go into hypotheticals. February 5 is the date. I just urge everyone, please go and get vaccinated in the lead up to that date.
The app that launches tomorrow.
I couldn't hear you, Peter.
The app that launches
Yep.
tomorrow, the new app. What were the sort of final features and functions that are going to be in that?
We'll release it tomorrow.
Just back on RAT testing, the Rural Doctors Association is calling for them to be available right across regional and rural WA and Australia. Is there a plan to make sure supply is evenly spread across
Yeah,
the state?
that's what we'll work on when we get additional supply. We'll make sure we make it as available as possible across the state, both city and regions. But I just want you all to understand, nothing's perfect with COVID. Nothing. As you've seen over East, things, problems, issues develop. And so whatever we do, whatever happens, nothing will be perfect. So just urge people to have understanding as we go through this process over the coming months, that things will happen that won't be great, things won't be perfect, but the good thing is we've been able to get our vaccination rate right up, but we need to get it up more.
On school preparation, I think in November, mid-November, we saw about 27,000 education staff had responded to a survey about who intended to get vaccinated by the start of term 1. That's still 10,000, 15 short of, it's a very big department, so there's a lot of people that have responded. Have you had any updated numbers as to how many people have responded? And if there's a big gap in people who have come back to the department, is that a bit of a concern considering we're only a few weeks out from school and not knowing how many people might not actually be vaccinated?
We'll get updated figures and we'll release them as soon as we can. The thing is, though, that teaching staff and education assistants and admin staff are on leave. So it's a little bit hard to get exact figures with those people at this point in time. So as soon as we get updated figures, we'll release them. But as I outlined to you before, contrary to what a lot of commentators had to say, our vaccination rates are extremely high, and that's without a major outbreak. Some very small outbreaks, actually. So our vaccination rate, 93.9% for those aged 12 and over. Over 16s, which is what the other states mention, or what they use, we're over 95%, 96%. So that's very, very high. And we've managed to achieve that without a major outbreak all over Western Australia. So we're very pleased with those figures, but the most important thing we need to do now is get that third dose out there and get people third dosed as soon as they possibly can. So our clinics have lots of people now getting through and getting their third dose. You don't want to be in the line on February 4. Leave it to the last minute and you won't get done. So I just say to people, go and get yourself vaccinated, get your third dose now.
The original modelling was, the release was based on Delta. How is the reopening plan going to change because of Omicron? What should people prepare for in terms of more restrictions and so on?
Well, there will be more restrictions, particularly on the unvaccinated. So I outlined that before. So that will be one of the major things. Now, they will be a very small part of the population, but they won't be able to go to the football, they won't be able to work in a whole range of industries, they won't be able to go to concerts, restaurants, bars, cafes, pubs, fitness centres, gyms, all those things will be restricted to the unvaccinated won't be able to go there. So it's a big encouragement to go and get yourself vaccinated. The other thing is, as you might have noticed over East, the intensive care units are filled with the unvaccinated. Overwhelming majority of people in intensive care and on ventilators are unvaccinated, even though that's a tiny proportion of the population, hugely overrepresented in the ICU. So that's the evidence you need to go and get yourself vaccinated. And I know I've experienced it. Some of them yell and scream and abuse and carry on, but we're just trying to save their lives. So I just urge the unvaccinated, please go and get vaccinated now.
So is it a pseudo lockdown of the unvaccinated when WA reopens?
Well, it's very strong rules around them. They'd be able to work in some industries, limited numbers, but there's a whole range. They're able to go to supermarkets and get essential supplies and the like, but a lot of the things we take for granted and the things we enjoy, they won't be able to do. And that's because we want to protect them and save their lives and we want to protect other people from their transmissibility.
The
Do you
Prime
think that
Minister
the
said
vac-
today that the best medical advice he's getting is to, quote, push through the Omicron wave instead of lockdowns. Is that consistent with the health advice you're getting, to push through and keep reopening?
I can't say that I really understand what that means.
Sorry, just on the unvaccinated and restrictions around them again, do you think what the Northern Territory brought in recently, which was sort of restricting their movements and how far someone unvaccinated could travel, do you think that was a bit too extreme, or it could have use in some settings in WA post Feb 5?
We've said for months that those regions that don't at least reach 80% double dose, there'll be restrictions on movement into those regions. So the one we're most worried about is the Pilbara. So unvaccinated people won't be able to go into the Pilbara. So that will be something that kicks in on February 5. So that's a restriction on the unvax. So if you're unvaccinated in the Pilbara and you leave, the chances are you won't be able to go home.
That could
If
be
you're
right.
resident?
You're in the Pilbara though.
Yeah, that's right.
So residents, if they leave...
I've said this for months. I've said this probably 10 times. That's what's going to happen. So I just say to those people who are unvaccinated in the Pilbara, go and get vaccinated.
But unvaccinated, if you're unvaccinated in the Pilbara and you stay in the Pilbara, having that territory level of restriction where you can't move a certain distance from where you live, is that too far?
There might be, look, I haven't considered that, but there might be rules around Aboriginal communities in particular, who can go in and out of those. We've had those before over the course of the last 2 years. There's lots of Aboriginal communities in the Pilbara. That might be a rule that's in place.
Have you seen modelling for WA based on Omicron?
I'm sorry, Rihanna?
Any updated modelling based on Omicron? Have you seen?
Look, I haven't seen any modelling. I understand we're getting some in coming weeks, so we'll consider that then.
Are you worried about panic buying of rapid antigen tests in the weeks leading up to February 5?
Yes, I am, and I just urge everyone to be reasonable and fair. I'd urge businesses to make sure you ration them out. We can't just have some people go and buy large numbers and then, put them on Gumtree. We've got to do our best to make sure everyone gets their share. But, we're dealing with a difficult situation. If the Commonwealth gives us our share, that would be good. We've got millions upon millions upon millions on order at a state level. So we're expecting many of those to arrive before February 5 and many more before the end of March.
Is
And
there
the
anything you
national
do to
piece-
try and prevent scalping of rapid antigen tests like we've been seeing over east?
Well, we can try. We can try with those sorts of things. Look, we'll watch what happens over east, and perhaps the market will moderate, and perhaps there will be some Commonwealth laws kick in around those sorts of things. But February 5 isn't far away, and they're actually available now. So Parliament is sitting. We can't pass any laws. So there's limited things we can do about that. Sorry, Gary, you have a question?
I do actually. Two questions in one, I think.
You kept trying to
I've
get
been away for
yourself.
3 weeks.
You
I'll
keep-
ask one. Hey,
Okay.
maternity, in terms of babies being born in hospitals, have you had chats about how that's going to change after February 5? Because we understand that there are changes afoot in terms of visitors and so on and so forth.
Well, our current rules around hospitals are you have to wear a mask if you're in a hospital, so I expect that will continue. I actually think that's very good practice, more broadly. Mask wearing in hospitals, even outside the COVID environment. In terms of child birth, no, I haven't been advised of anything. If Health's working on that, well, it's probably a good thing.
And how do you feel about being featured in the latest Sam Kekovich land map? It's just a cameo at the end.
Yeah, I saw that.
It's not you, obviously. But
The map looks very similar to a map I've got in my office, so I'm not sure how they got in and filmed it, but it was a very funny ad.
Is it a crack at you though? That
I don't know.
you're the only one that's not sort of trying to introduce Australia to the rest of the world?
I don't know. We're the only one without COVID, so I'll take that any day.
Does it depict, though, WA being isolated from the rest of the world? Is that a good or a bad thing?
Look, I suspect if you're in the middle of Sydney and you can't go to work and your family's got COVID and everyone's locked down, you probably prefer to be in Western Australia. So, look, if people want to attack us for that, I don't care.
You like lamb? You like lamb?
No, I'm fond of lamb. Fond of lamb, I'm fond of beef. Fond of kebabs.
In terms of the rapid antigen tests, pharmacists have encouraged people to have at least a couple, at home before the borders open. Is that something you would encourage as well?
Yeah, I think people should get a supply. We'll get as many as we can, and I understand businesses are trying to get their share as well. You just don't want people to go and buy hundreds of them and other people not be able to get them. And you also don't want people just going and using them. There's no need to use a rat test now. We don't have spread of COVID, and if you're unwell, go and get a PCR test at one of our clinics. They're sitting there, they're free, they're available as we speak. So I just encourage people, if you get a rat test, please don't use it now. We only need to use these things when necessary, and we don't want to run down the supply when we don't have community spread of COVID.
You're on
The
Gallagher
World Health
says in the
Organi- the World Health Organization said they wanted to try and work towards the global pandemic by July. When do you think?
I couldn't understand your question.
So the World Health Organization
Yeah.
wanted to see the world working towards the pandemic being over in July. Obviously, our emergency state laws are based on there being a declared pandemic by the WHO. Do you think it will end? Do you think there's a possibility it'll end this year? And if so, what kind of legislation might you have to work on to be able to keep in force things like mandates on vaccinations and improved vaccination?
Look, I don't have a crystal ball. Look, it's nearly 2 years it's been happening now. If you said to me in March 2020, this would still be the dominant issue in January 2022, I wouldn't have expected it would be. But here we are. So it may well be it goes on for a lot longer. No one has a crystal ball. No one can predict these things. No one can say what will or won't happen in the future. The thing about COVID is it's the most unpredictable thing I've come across in my entire life. And we'll just continue to do the best we can in the circumstances we face.
You mentioned the flight coming in from the Northern Territory tonight. They're elevating to high risk now, likely to be extreme risk soon. What can you say to those people, given soon to be extreme risk everywhere but WA, to those people who are still stranded, whether their fault or no fault of their own, who is it now that there's no way for them to get back until February 5? Is there room for any compassionate, what is the criteria for any extraordinary compassionate exemptions? And some of them are complaining just that the risk level was upgraded before there were even any flights available. They literally couldn't get back in before they went to Australia.
Look, we've been through this for 2 years. We've had open borders with all states in Australia and all territories at various points in time. So some people are saying I've been stuck in another state for 2 years, but I don't understand how that's possible because we have actually had open borders with other states, every single state and every single territory at some point in time. So New South Wales included and Victoria included. You've got to remember they were at zero just 6 months ago, 6 or 7 months ago. So we were open to New South Wales. So people who say they've been stuck for a couple of years somewhere else, it's not actually true. They could have come home. In terms of people who are over there now, look, the extreme risk setting is tough, and it's designed to protect Western Australia and stop the importation of the virus into our state. All I'd say is apply through the G2G pass system, put your case to the police. They manage these things, and I know they look at these things as best they can to try and manage people in if required, but it's a tough system.
They're automatically rejected when they goes up.
It's a tough system. We have a tough system. We don't have any COVID. New South Wales has, 40,000 cases today or thereabouts. Victoria has 30,000 cases, multiple deaths. We have a different approach. But what we have to do is get our vaccination rates up. That's what we're aiming to do before such time as we open borders.
The
In
national
terms of the
testing
supply
regime,
chain.
the weekly testing regime for truck drivers nationally is being dismantled. How big a threat does that pose to the Western Australia?
Well, we had 227 trucks come through the border at Euclid yesterday. Every single truck driver was rat tested. One returned a positive. He remained in South Australia. It's the best system we can put in place to ensure continuity of supply and ensure we get the truckies tested. We have to have continuity of supply. The truck drivers bring in food and provisions and essentials from the factories and the farms in the east. So we have to have it. So the rat testing system on the border has worked effectively so far, and it will continue.
And we've
Are you
already
concerned
seen
about some of the
shortages supermarket
supermarket?
shortages are already occurring. Do you expect that will get worse in coming weeks and even worse post-February?
Look, the Commonwealth Government has changed the arrangements for the close contacts and indeed for the positives who are in the freight and logistics area, and we support those changes. So hopefully that will alleviate supply issues.
And you'd look to do something like that here in terms of those sort of workers when we get close to that border
Well, that's what we're working through, so we can watch exactly what's happened over East and work through exactly what the arrangements will be in place in Western Australia. But I just remind you all, nothing will be perfect. I know people seem to think that somehow it will be perfect here. It's not perfect anywhere in the world. And there will be problems, there will be issues, there will be lines at certain things, there will be increased demand on our hospitals. All those sorts of things will happen. There is no avoiding that.
Non-COVID, there was another fire at Warraloo yesterday that police have confirmed is suspicious. If there's an arsonist targeting that area, what would you say to them?
Please stop. Please don't do it. There's a strong chance you'll get caught, and if you're caught, you'll go to jail for a long period of time.
Also non-COVID, some concerns from the timber industry. The native forest logging industry, when they were told that would cease, they were told their contracts would be filled until the end of 2023. They're now being told their contracts for this year won't even be met. Why has that changed?
That's not correct. So they'll receive a consistent supply of volumes the same as they've received over the last 7 years. There's a range in which of timber volumes they can be supplied. What they're seeking is the upper limit, but what they'll receive is consistent with what they've received over the last 7 years. Thanks very much.
Thank you.